Hello, everybody, and welcome to Valley Life. I'm Rich Krebs, and I had the pleasure of speaking with Dr. Peter Birnbaum and got into some different specifics of the heart and the aorta, and of course, that just piques my interest to go even farther. But I also wanted to emphasize the point that we have an expert right here in the Central Valley that is doing fantastic work and making it easy on people to have repairs to their heart to getting back to living a happy and healthy life. Dr. Peter Birnbaum, how are you, sir?
Doing very well, thank you.
Good. Well, I'm sorry to bombard you again with more questions, but I absolutely love it when we have an expert here locally we can talk to. But I wanted to get into the mitral valve. There's what's the difference between, one, let's get into what a mitral valve is in the heart. I obviously got excited about all the information, but then what the difference between replace and repair is and the fact that people have options.
Okay, great. Well, as you know, the heart is a muscle that pumps blood. And within the heart, we have the valves. And the valves will direct blood flow throughout the heart. And of course, when those valves develop disease, patients can have very severe symptoms like labored breathing, fatigue, even congestive heart failure, which can ultimately lead to death. So in the operating room, when we look at the mitral valve, we have options. And those options can either be to replace the valve with an artificial valve or a valve that may come from a cow or a pig. But another option that I like to consider first is mitral valve repair. So in mitral valve repair, the patient will preserve their own valve, and we'll use a variety of techniques to have the patient maintain their own valve, and then they don't even need replacement with a cow valve or a metal valve.
Okay. You had talked about blood flow and the direction of blood flow, and what the valves do then if a certain part of the heart squeezes then is they'll close off or they'll allow that flow to go. So when they're not working properly, like you said with congestive heart failure, basically things are moving, but the blood isn't.
You're right. When the valve becomes abnormal, then the valves can leak and flow can go in the reversal direction.
Okay. And now using the techniques then of repairing your own valve actually ends up healing a patient much quicker than having to go in and have surgery.
Right. I think by repairing the valve, clearly the data supports that the durability will be good and the preservation of heart function will be better.
Now, you also handle, then, if it needs to be, that, we just aren't able to repair your own valve through means of your own exercise or different techniques, and the repair needs to be done, then that's something you handle as well.
Right. And then, of course, if the valve is not repairable, you're absolutely right. Then we do have the option to replace the heart valve.
What are some typical symptoms if you have the congestive heart failure or things, I guess, the treatments that you're looking to give people to get them back on the right track? What are some of the symptoms that they would need to see first?
Patients would notice some of the early symptoms would include things like fatigue and then lack of energy.
Okay.
Then they may notice some swollen ankles, some labored breathing, decreased exercise tolerance, and then congestive heart failure is quite a severe disease where the patient may report feeling like there's an elephant on their chest and they're gasping for every breath and they have to call 911 and get treatment at the hospital.
Well, Dr. Birnbaum, in doing some of my research and talking about some of the repair techniques that you're able then to facilitate, a lot of the people that have written some of the textbooks even talking about how this was done and these techniques that were invented are the actual guys hands-on that have trained you to perform these procedures.
Yeah, I was very fortunate that I trained with some of the pioneers of these mitral valve repair techniques, and I've been really fortunate that then I can pass these techniques on to my patients here in the Central Valley.
And I think a lot of people just have it in their mind, that even though we're over 500,000 people in Fresno, we think that we've got to go to the big cities to find the best experts in the field. Not so. You've done hundreds of these and are considered one of the best experts in the country at creating these procedures.
Well, I think I was fortunate to be trained by the great pioneers of mitral valve repair surgery, and I know for my whole career here in the Central Valley, I've been able to apply these techniques and help lots of patients with them.
And before we run out of time, do you find that a high percentage of people are actually able to do a less invasive repair than having to go through, you know, the major trauma of different surgeries when they come and see the options that you've got for them.
Yeah, absolutely. You know, in my practice, I've been able to repair the majority of mitral valves that come to the operating room.
Well, Dr. Birnbaum, it's always a pleasure, and I sure appreciate speaking with you. Thank you so much.
Thank you.
Well, Valley Cardiac Surgery is the place you need to be coming here in the Central Valley. We are blessed to have experts like Dr. Peter Birnbaum right here that can handle these procedures to get you right back to optimal health. And we've got them right on Health Connections on the kmph.com website, so you can get all the information that you need. Don't go anywhere. There's more Valley Life coming up right after this.